Hi, this is Dr. Richard Lipman, and I'm providing you with a review of the injectable semaglutide weight loss drugs. These include 3 drugs: Ozempic, Wegovy, Mounjaro, and the new generic semaglutides. These drugs begin about 8 years ago with the approval of Ozempic, which was first used for diabetes. Significant weight loss was noted, the doses were increased, and they found 15 to 18% of body weight loss over 6 to 8 months. They called this new drug Wegovy, and it was approved last year. It became so popular that the company ran out of the materials, had production problems, but are said to be reintroducing the medication in January 2023. About 4 months ago, another drug, Mounjaro, was released. This proved to be even more successful than Wegovy and Ozempic because it consisted of 2 hormones. A few months later, semaglutide was released as a generic. Because of the scarcity of the brand and because of the popularity, we have used this over the last 2 months with considerable success. Here is a comparison of Mounjaro, Ozempic, and Wegovy. The first 3 columns are Mounjaro at different doses of 5, 10, and 15 milligrams. Then Ozempic at a low dose, and then Wegovy and Ozempic at higher doses. Note the greater weight loss with Mounjaro as compared to the older drugs. Here's a comparison of Mounjaro, Wegovy against the standard weight loss drugs Qsymia, Xenical, and Adipex. Note the Mounjaro column, the patients experienced 25 to 30% weight loss, while with more standard weight loss medications, the weight loss was only 8 or 10%. Here is Wegovy treatment over 98 weeks in over 500 people. Note the progressive weight loss related to the dose that continues uninterrupted for at least 98 weeks. Here is a comparison of weight loss with Ozempic, 1 milligram, Ozempic 2 milligrams, 16% weight loss, and the compound Ozempics, and the compound semaglutides, and Mounjaro. Weight loss was as high as 25 to 30% in the Mounjaro group. Even low doses of semaglutide, Wegovy, and Mounjaro are effective. Here, the individuals lost 16.2% of their body weight after you're taking very low doses. How do these drugs work? In the stomach, there are cells in the duodenum where 2 hormones, GLP and GIP, are produced. These circulate all over the body, attached to receptors, and have various actions, all to reduce eating and produce fullness. In the brain, they decrease appetite, they decrease cravings, especially for carbohydrates and salty food and fatty food, and they produce fullness. In the stomach, the major effect is to delay gastric emptying time by almost producing a block in the distal pylorus. Other areas include the liver, where the drug stops the output of sugar, in muscle, where the drug increases sugar uptake from the blood, in the pancreas, where the drug increases insulin release and decreases glucagon release. Glucagon is the hormone responsible for hunger. All of these effects combined together produce the significant weight loss seen with these drugs. All of the side effects are due to the effect on the stomach. Unlike other weight loss drugs where there is effects on the brain with side effects such as anxiety, nervousness, insomnia, all of the side effects of these drugs are related to gastric changes, and nausea being the number one effect. Nausea occurs in about 50% of people, severely in between 11 and 20% of people. Enough to stop taking the medications? Not really. Usually the nausea goes away in 2 or 3 weeks, and is often related to the changing of the dose. Diarrhea and constipation occur with much less frequency. If one is overeating, one experiences some abdominal pain and reflux and some vomiting. Again, this is fairly rare, occurring in only 5% of people. But all of these effects are noted with all of these medications. Wegovy may be slightly less in these effects, while Ozempic slightly more, but not significantly so. All of the side effects can be reduced by taking lower doses. This is an Ozempic pen. The only medication of the 4 that comes in a single pen, is Ozempic, where the dose is dialed in using a dose selector. Wegovy comes in an automatic injection pen. All of these medications are given once a week on the same day of the week. Wegovy and Mounjaro, the pens are used one time and discarded. Ozempic, the pen is multiple use. The semaglutide compounded drugs use a liquid standard insulin syringe. In order to reduce side effects, the doses of all of these drugs are slowly increased on a monthly basis, starting with a very low dose of 0.25 milligrams for Wegovy, Ozempic, and the semaglutides, and rising slowly over several months. Doses can be skipped, but in general, most patients start with a little higher than the lowest dose at 0.5 milligrams. This is what a Wegovy box looks like. Inside the box, which is enough for 1 month, there are 4 pens. We suggest the injection should be done on Saturday because Saturday is a day where people eat more, and if there is nausea or vomiting, it would be confined to a non-work day. Here is what the 4 pens look like inside the box. Each pen is 1 injection and then discarded. This is the Mounjaro pen. This is the most rapid weight loss. Again, we start with low doses and gradually increase the dose. Most people start with the 5 milligram dose. This is what a box of Mounjaro looks like. This is the semaglutides. These are compound drugs made of semaglutide and either B12, B6, L-carnitine, or a larger dose, 2.5. An insulin syringe is used with a tiny needle, and it's injected similar to an allergy shot or insulin itself. It comes in ampules. There is a wide range of effects of semaglutide that is but no significantly more side effects than seen with the other drugs. Here is a comparison of semaglutide 1 milligram and 2 milligrams, 12 and 16% weight loss, versus Mounjaro, which is slightly more. This is over 40 weeks. This shows you the effects of semaglutides on liver fat, and there was a remarkable reduction in liver fat with semaglutides, as well as weight loss of about 25%. Here is a reduction in fat in the abdomen and in the subcutaneous areas, comparing this area to this area, of between 25 and 30%. So the drug works in many areas of the body simultaneously. This is a food menus that were designed to be used with our 1,000 low-calorie diet. They can be downloaded from my app under app 1H and 1G. There's a food menu for breakfast. There's a food menu for lunch, snacks. There's a food menu for dinner. This shows you what happens if semaglutides and all of these drugs are terminated abruptly. This is 500 patients taking semaglutide for 20 weeks, and at the 20-week mark, they reached the 15 milligram maximum dose. This was specifically Mounjaro. At that point, Mounjaro was continued in half of the patients, while the other group received placebo. Note, over a year, there was a 50% regain of the weight that was lost. We tried to prevent this by using maintenance therapy of 1 injection a month or 2 injections a month at the end of the weight loss period. This shows you how these drugs work. Ozempic, Mounjaro, and the rest of the drugs work by slowing the emptying of the stomach. And this is a picture of the stomach. Note the stomach is tossing and turning food with the purpose of digesting it. But food is not absorbed from the stomach. Food is absorbed from the pylorus and the small bowel down in here. So any food that's in the stomach will stay there until the stomach empties. The drug's effect is to keep the stomach full and prevent further eating. Many things can affect the stomach and the food, including skipping meals, eating 1 large meal a day. Nuts and seeds can easily escape the stomach, and drinking too much water even. Okay, the whole concept is to keep the stomach full. This prevents further eating and produces fullness and satiety. What specifically we do not want is carbonated drinks, which with the gas and the liquid together would push all this food out of the stomach. There's a 30-minute rule, and this was obtained from the bypass gastric surgery studies, and it suggests that the best way to control extra water ingestion is to follow this 30-minute rule, that from 30 minutes before the food, through the food, and 30 minutes after the food, to limit the amount of fluids to the minimal. One can imagine if one ate this whole meal and had these 2 glasses of water, the food that was in the stomach would just be pushed out, leaving the water, and the water would empty quickly. Specifically, we want to try to avoid carbonated drinks, which are even worse. These are the 4 drugs that we are considering: Ozempic, Wegovy, Mounjaro, and this is the new compounded semaglutides. Prices of these drugs are very expensive if not covered by insurance. Ozempic has a retail price of $800 with a discount card. Wegovy is off the market currently, but when it comes on the market, the retail price without insurance was over $1,000. Mounjaro currently has a retail price of $900. And the compound semaglutides depend upon which preparation is used and how much is used, and range anywhere from $90 to $150, as much as $200 per month. Thank you for your attention.